Hello, everyone, and welcome. And thank you for tuning in to Health Leaders, the place for peer sourced and solution focused insights for healthcare executives. My name is G. Hatfield, and I'm the nursing editor for Health Leaders. Today, we're talking to Dr. Dre Carpenter, who is the Senior Vice President and Chief Nursing Executive at Allina Health, about his career and his thoughts about trends in the nursing industry. So, hi, Dr. Dre, how are you?
Hey G, great to be here. How are you?
I'm doing well. Thank you for asking. So, let's jump right in. How did you begin your journey into nursing?
So second career nurse, nursing has always been sort of instilled in me since I was a child. I was knew probably that I wanted to be a nurse at 13 years old. I had the fortunate
Wow.
experience of growing up in a home. My mom was a medical social worker, so my sister and I spent a lot of time in healthcare settings with her.
Mhm.
Initially, we thought it was, sort of an intentional thing, but what we later found out is that it was her way of avoiding after school care. And as a smart single mom, that was a great way to do it, which was just to get us signed up for volunteer work there. I was on one of the unfortunate males, though, however, that was talked out of nursing. So I hear a lot of that in our industry. So you see a lot of men coming into nursing as a second career nurse, which is what I was. So I had an opportunity to have had an experience in the computer science world, doing some software engineering work. But I never stopped thinking about being a nurse. And so I decided to pursue it full time while I was working a career and raising a family. And ultimately pursued my dream of becoming a registered nurse, and that's how I got into the profession.
Absolutely. So I'm curious about that. Why do a lot of men come in as second career nurses?
I think we've evolved over time, and we're
Mhm.
seeing a lot of men finding themselves a place, I think, in the profession early
Mhm.
on. For me, it was some of the same trends that we saw. I actually had someone tell me that I didn't look like a nurse. So, why would you want to go
Oh,
into the profession? And there were a number of different things that people sort of put in front of me as to why it wasn't a great decision to pursue the profession. So I think we've changed over time. I'm certainly now myself advocating and mentoring a lot of young men who are excited about the profession, and certainly we see a movement there. But yeah, I think those are some of the areas.
interesting. So kind of along those same lines, who have been some of your biggest influences?
I've had the fortunate opportunity in my career to have had some great mentors, former supervisors and leaders that I've had the pleasure of reporting to. I can think of a couple just that have really stood out. Dr. Susan Campbell is one that has been a huge inspiration of mine. She was a former CNE of a very large system in the Midwest, and I'd be remiss if I didn't mention my mom because she's sort of that one who planted the seed in my head and in some way has shaped and helped inform what my career is.
Mhm.
Coincidentally, she was one of the ones who told me that nursing probably wasn't a good choice in the beginning. So
Wow.
she sort of evolved in her thinking around that over the years, and I think some of my success has certainly changed that. But I've been very fortunate to have had some really good, inspiring mentors that have led me in my career journey.
That's good. Yeah, it's always good to see that change in thinking, especially in parents. But what was your best mistake and what did you learn from it?
As a eager and new nurse leader, one of the things that I learned from early on was the importance of including the entire voice of nursing. When
Mhm.
we get to leadership, decision making, and our strategic roles, we often forget that our frontline leaders are our best strategists, and
Mhm.
that the things that we're trying to solve for or create improvement around, more often our team members are thinking about this day in and day out. They understand the challenges because they are experiencing them in their careers. And, I remember some initiatives that we set out for, and we spent a lot of money trying to create process improvement around things.
Mhm.
And the best example I have of that is a story of a staff nurse that we had spent a lot of money on sepsis protocols and trying to improve sepsis workflows in the hospital. And had a very frustrated project and leadership team because we weren't necessarily seeing the results that we wanted. And so I
Mhm.
finally said, we need to invite some staff nurses into this conversation. And I remember a young lady that worked with us came into the boardroom. She was so excited to be there. She took a couple selfies with the leadership team at the table to sort of memorialize her presence there. But then she asked a very simple question to us. She said, your goal is to get us to improve our compliance with this particular part of the workflow. We said, yes.
Mhm.
And she said, well, why don't you just embed it in our shift assessment? And it
Mm.
was like a pen dropped in a room, and it made so much sense to us that we did that. Went from a 56% compliance rate to a 97% compliance rate immediately after implementing that, and it was all because we invited someone to the table that probably should have been there at the onset of the project. So that's one of the biggest mistakes I've learned from, is to treat our frontline team members as strategists and invite them to the conversation.
Yeah, very interesting. So what do you think are the biggest challenges currently facing CNOs and CNEs in nursing right now?
I think healthcare is a complicated industry. And certainly, I'd be remiss if I didn't mention the challenges around labor and all the things that we're trying to do to ensure that we have the proper resources and the proper labor to support care delivery in an effort to support our communities. Also, we're at a time where there's a lot of inflection in nursing about the future of nursing as a professional practice organization. And that's something that's very important for
Mhm.
me, particularly in my new role, is ensuring that we're creating and optimizing a professional practice environment where clinicians want to come work for us, where they feel empowered to do the jobs that they need to do in supporting quality, safety, and experience of our patients, serving our communities, but that they have the tools, the resources, and what I call the combined brain trust to deliver
Mhm.
upon that. And those are some challenges the CNOs are facing every day. How do you balance a well and healthy workforce with the shortage of labor to support that, with the rising incidence of workplace violence? All of those things, I'm sure, upon CNOs as we think about that. And certainly an opportunity for us to support each other in the community as we try to continue to evolve healthcare.
Absolutely. Yeah, I'm seeing that across the board from all of the CNOs that I've talked to so far.
No doubt.
Yeah. So, what are your thoughts on strategies for recruiting and retention to address the shortage that you're talking about?
Yeah, so we have to do a couple different things. We have to first create a really um, optimized pathway for team members to get into the profession, into the organization. So those pipeline programs are going to be important. We got to do that from a place of equity and inclusion.
Hmm.
So more often tapping into those communities of team members and others that really want to break into the profession of healthcare, but they have barriers that often prohibit them from doing that. So that's a big area that we got to make sure we address. We got to create an environment that's really enticing for team members to want to work with us, and that's creating that healthy workforce balance that I mentioned before. And that's something that needs to be really core at our recruitment and retention strategy. So, working with the leaders to make sure we're engaging in team members in a way that's meaningful to them, that we're having conversations about where they want to take their career, even for those that are just starting the career. And the multi generational aspect of that, our latest generation of team members entering the workforce are thinking about their careers 5 to 10 years down the road from day one of employment. They want to know, where am I going to be in a year? Where am I going to be in 5 years? And how are you providing a pathway for me to get that? And I think those conversations around independent development needs to start really at the onset of career at new to practice. So those are some of the things that we have to work on in the profession.
For sure. And to kind of piggyback off of that, and you were mentioning earlier bringing frontline nurses to the table as strategists. So, what role does diversity, equity, and inclusion play in improving culture and even patient care?
It's a huge role. It's so important and it's critical. I've been in my role now just over 3.5 weeks. At the end of this week will make my fourth week here at Allina, 1 month in. And one of
Congratulations,
the
by the
I
way.
appreciate that. Yeah, it's always a journey.
Mhm.
Um, One of the things that I joined the organization was really because of the communities that this organization has the pleasure of serving. When you think of Minneapolis, St. Paul area, and the Twin Cities, and our geographic metro area up in Wisconsin, there's a lot of diverse communities that exist there.
Mhm.
And so I think it's an important part of my role, as the leader who has the pleasure of leading the largest workforce within the organization, to ensure that our team members and our workforce represent the communities that we serve. And that is something that, from a programmatic standpoint, we have to make sure that we're embedding into our recruitment and retention culture.
Absolutely. So, what are some of the strategies that CNOs could take to embed that in the strategy?
Yeah, I think one that is just really a rich opportunity is looking at internal equity within the organization.
Mm-hmm.
I'm getting inspired by some work that I did before previously in my previous system, but some things that we're talking about here at this system around promoting internal equity for team members that already exist in our organization. When we look at our supportive staff, our EVS transport, food and nutrition staff that work elbow to elbow with our clinicians every day, a lot of them have aspirations of becoming clinicians. And
Mm-hmm.
are we being intentional about providing and setting up those pathway programs for them to be able to propel themselves into a clinical career if that's what they desire to do? I think that's one that's just really low hanging fruit and easy, and it promotes internal equity in your organization. You're treating your family members that are local to your workforce as a part of the team and helping them grow their profession. Another way to recruit and retain staff.
Absolutely. It's all about opening doors for people, right?
I agree.
Um, yeah. So to kind of pivot a little bit, how can CNOs help prevent workplace violence and support their nurses after incidents occur?
This one is tough
Mhm.
because the incidence of it is so right in front of us. We see it rising every day. We have and we hear about it, and it's always shocking, and when you hear about it, and we've created almost sort of a reactionary way in which we're responding to it.
Mhm.
But it's the prevention piece that I think we miss the opportunity to focus on, and that's something that we're doing here. And what I mean by that is, are we looking at situations where we're equipping our team members to really de-escalate in situations where we know, there's stress rising, there's agitation and psychosis with patients and families. Are we addressing it in a way that we're equipping them with the tools that they need in order to prevent these things from happening? And there's a
Mhm.
lot of focus work, at least in my organization, I think nationally, that's happening in that space. And we need to continue to double down on that and create safe environments. The other thing is, I think we need to think about it a little bit differently. So in healthcare, we often focus on things that are traditional to the profession or the industry. And when you think about safety and safe workplace environments, there are other industries that are ahead of us on this. I think about the airline industry, for example. One of the safest places that I often find myself at, I feel, is in an airport. As I'm
Mhm.
walking around terminals and getting ready, you feel safe in those environments because there's systems in place that have been intentionally worked on in order to support some of that. And I think we need to probably take a step back and perhaps even look into what other industries are doing. How are they creating and sort of maintaining safe environments? What are the tactics and tools that they're using to equip their team members with? And I think we could probably take a play out of some of those other playbooks as we think about how to create some improvement in this space.
Absolutely. It's kind of that psychological safety piece, right? Because obviously
It's
physical safety
so
is very
important.
important, but yeah,
It's
they're
so
both
important.
important for sure. So speaking of psychological safety, what do you think health systems can do to increase overall nurse well-being and promote better work-life balance?
We got to talk to our people.
Hmm.
We have to understand what's important for them. So, balancing family and home life. We have to create a variation of ways that they can engage and work in our environments, whether that's creating some non-typical shift assignments and different things that allows them to balance between the needs of work life and then the needs of home, which is more important. So we have to do that in a way that we understand what our team members need. We do a lot of engagement surveys in our organizations, and those are always cool and neat to see where our team members are thinking. But I think
Hmm.
it's taking that even beyond that and looking at some of those specific areas for flexibility and to be able to provide an environment where our team members feel like they can have the balance of home and work.
Absolutely. So, what new technologies do you foresee changing the landscape of nursing?
So it's sort of an inflection point in nursing right now where we're actually able to talk comfortably about technologies and the evolution and innovation of it. So it's an exciting time for me. Again, my first career was in computer science. I was a
Mhm.
chief nursing informatics officer, a chief data officer, in addition to my roles that I have now. So this is where I get really excited. And I would be remiss if I didn't mention the advancements in virtual nursing. I
Mhm.
believe it is part of our future that is going to be sustained and optimized as we think about how we can leverage a virtual nurse to augment some of the care delivery that's happening at the bedside. There's so much opportunity, and I think it's taking a step back and looking at the profession overall, looking at the things that we're asking our clinical team members that are in the environment, what we're asking them to do on a day to day basis, and asking ourselves the question: is there a different way that we can do this? And that's one of the things that we've been doing. When you think about virtual nursing, that space sort of started in this area of admissions, discharge, education. We can do all of that virtually. But now we're getting into some really cool ideas around the concept of surveillancing. And
Mm.
the ability to be able to look at different data elements that exist in the chart in the system, in the electronic health record system, and putting a team member in a position to predict things that may happen in those environments, whether using predictive analytics or dashboards or some of those other things, and sending alert and signal to the team members on the ground for things that they may not necessarily be able to see or be aware of outside of the clinical environment. So
Mhm.
there's some exciting things that are happening. We're just sort of on the precipice of talking about virtual nursing in our system, but I'm excited to see where that potentially may go in the future.
Absolutely. It's definitely a fascinating kind of unexplored area, I think for a lot of people.
I agree.
Um, yeah, so to pivot back to you personally, what are you most proud of?
I am extremely proud of being a nurse. I think I have the pleasure of getting up every day and working in one of the best professions, one of the most trusted professions. I'm excited about healthcare, even though we are challenged in a number of different areas. I'm excited
Mhm.
about where we can, take care delivery to our communities in the future. And that, for me, aligns back to the mission and vision of our organization here at Allina Health and how we're supporting our communities. And I'm proud of our team members. I would be remiss if I didn't mention that. Our team members are so engaged. They're showing up for the right reasons. And I just want to be able to continue to support the work that they're doing, and ensure that they have the tools and the resources that they need in order to continue to serve our patients. And that's something that I'm very proud of.
Absolutely. And then to follow that, do you have any advice for CNOs or CNEs?
You know, um, I would say just we're again at that really inflection point of how we treat the profession moving forward. I often say one of the things that I love about nursing, and when you think about our history, it's the rich tradition that we have in the profession. But when you think about it, it's one of the things that often keeps us back because we tend to fall on tradition to solve our way out of problems the same way that we've
Mm.
always done them. So the biggest advice I would get is be a little disruptive. Um, be a little bit in the area of thinking about things a little bit differently as we try to transform healthcare because we're at that place where healthcare is sort of moved to this structural sort of economic system that's really impacted by many different areas. And so I think we have to be a little bit non-traditional, if I can say
Mhm.
that, in our approach to how we're solving for some of these problems. I think that would be the best advice I would give a CNO.
Absolutely. I like that being a little bit of a disruptor. Alrighty. Well, thank you so much, Dr. Dre, for your time. I'm super grateful to have had this opportunity to get to know you and hear your insights. And thank you so much to our audience for listening.
Geez, such a pleasure. Thank you.
Of course. Thank you.